Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious diseases, hepatology, and gastroenterology. Our topic today about Erythema Nodosum. We will discuss symptoms, causes, treatment. Also, we will discuss diagnosis. Also, in cases of pregnancy. Also, we will talk about the outlook of the disease. As regards Erythema Nodosum, it is a skin condition that causes painful, swollen, red or purple bumps, most commonly on the shins. Sometimes the bumps can also form on other parts of the body. This condition is the most common form of panniculitis, which is inflammation of the fat layer underneath the skin. It is often caused by an immune response to an infection or a reaction to drugs you have taken. As regards the symptoms, the main symptom is red, painful bumps on the lower part of your legs. Sometimes these bumps can also appear on your thighs, arms, torso, and face. The lumps can be 1/2 inch up to 4 inches. You may have anywhere from 2 to 50 of them. Erythema nodosum bumps are painful and they may feel hot. They start out red and then turn purple, looking like bruises as they heal. They also flatten out while healing. The bumps can last for 2 weeks. New bumps can keep forming for up to 6 weeks. Other symptoms of Erythema nodosum include fever, fatigue, joint pain, pain in the legs, ankle swelling, also enlarged lymph nodes in the chest, cough, sore throat, weight loss, stomach pain, also diarrhea. Causes: in more than half of all cases, the cause is unknown. Erythema nodosum often starts after you have had an infection or you have used certain medicines. Doctors believe it may be caused by an immune system overreaction to bacteria and other substances you are exposed to. Causes may include infections such as streptococcal throat or tuberculosis, reaction to drugs such as antibiotics like sulfonamide, and also forms of penicillin, salicylates, iodides, bromides, and birth control pills. Sarcoidosis, a condition that causes inflammation in many parts of the body. Coccidomycosis, it is an infection of the lung and the upper respiratory tract. It is a fungal infection. Also sometimes inflammatory bowel disease like ulcerative colitis or Crohn's disease. Maybe pregnancy. Also sometimes cancer may lead to the disease, but it is rarely. Erythema nodosum most often affects people ages from 20 to 40. Women are 6 times more likely to develop it than men. However, it can happen in people of any age and in both sexes. As regards the treatment, if bacteria infection causes this condition, your doctor will prescribe antibiotic to treat it. You can treat Erythema nodosum that caused by drug reaction by stopping the medicines. These medicines can help you manage pain and other symptoms until the lumps heal, like non-steroidal anti-inflammatory drugs, also aspirin, ibuprofen. All this can lead to recovery from Erythema nodosum. Potassium iodide, oral steroids. Sometimes we use colchicine. Also rest with your legs elevated and wear compression stocking while the bumps heal. Also avoid irritating the bumps by wearing itchy or tight clothing. All this may help in recovery. As regards the diagnosis, your doctor will ask about your health history and whether you have recently had an infection or used certain medicines. Then your doctor will look at the bumps. You will likely get a blood test to look for signs of inflammation in your body. Blood tests also be used to check for tuberculosis and other infections. You may have a throat culture to look for streptococcal throat. Other tests look for the causes of erythema nodosum include urine test, chest X-ray, stool culture. As regards in pregnancy, about 5% of pregnant women develop erythema nodosum. The cause may be increased estrogen level during pregnancy. Erythema nodosum is treated in much the same way during pregnancy as it is in women who are not pregnant. However, some of the medicines like non-steroidal anti-inflammatory drugs used to treat this condition cannot be used during pregnancy. Bed rest and compression stocking can help manage pain and other symptoms. As regards the outlook of the disease, erythema nodosum can be uncomfortable, but it is usually not serious. The bumps will often fade within 2 to 4 weeks, but they can take up to 2 months to heal completely. You will likely have some bruising as the bumps fade, but they usually do not leave scars. Pain in your legs can continue for up to 2 years after erythema nodosum heals. It is also possible the condition can come back in the future. So the disease may recur every now and then, and the main treatment, it depends on steroids, anti-inflammatory and non-steroidal drugs as analgesic, and also we can use colchicine. All this medication can help to manage the condition of erythema nodosum. Sometimes erythema nodosum can we can diagnose it as cellulitis or erysipelas. So it enters in differential diagnosis of erysipelas and cellulitis. But as I told you, it is overreactive reaction from drug or infection immunologically. Thank you very much.